Our final speaker for this session is going to tell us how it's done overseas. Christian Theilacker works in the ARUD Center in Zurich and is going to tell us of integrated care models that they use over in Switzerland. Over to you, Christian.
Well, thank you very much for inviting me. Great pleasure to be here. I'm not so sure after these two wonderful examples for best care I can add much, but I will try my best. So I would like to show you how we have implemented an integrated model of care in Zurich for our IDU patients with chronic hepatitis C. So just to put you in the perspective, what's our setting in Zurich? We have roughly about 3,700 people which receive opiate maintenance therapy. Of those, half of them are treated by general practitioners, and the other half is treated by major institutions. The ARUD, my employer, is the biggest institution in Zurich. We treat about 40% of these patients. It's in total roughly 670 patients. As in other cohorts, many of these have a positive antibody test for Hep C. In our cohort, it's 73%, and active chronic hepatitis C is prevalent in a little bit more than 42% of the patients. So we have 290 patients, this number that you see is a little bit incorrect, with chronic hepatitis. It does make an impact on the mortality of our patients. We have done a retrospective analysis on the cause of death in our patients, in our cohort, and you can see it's not overdose, it's not accident or suicide, it's chronic liver disease. So, as you know, we only treat the tip of the iceberg at the moment, and we want to really get to the part of the iceberg that's below the surface. From a very subjective point of view, I'm just brought you some statements that I hear from my patients why they cannot get into treatment. Well, first of all, many of them still don't know if they enter the program that they're HCV positive, or they don't know about the consequences on their health of this infection. Many have psychiatric illness, which is a very important barrier to treatment, as you know. Others have just social problems, which on a personal perspective are much more important to them than their Hep C infection. And there are little things like they don't have money to fill the prescription, or we've heard it before, the time slots which are offered in special care are simply too rigid and too small for our special patients to meet their needs. And we have a substantial amount of people that still inject drugs while they are on opiate maintenance therapy. They don't want to give up this habit, but it will exclude them from many opiate maintenance therapies as well as treatment for Hep C in other centers. And we've heard this before, if you send the patients away to a university outpatient clinic, they either do not arrive there or they don't show up for the second appointment. So that's a major problem. What have we done to address this? Well, in our program, as in other programs, we systematically screen for Hep C when they enter the program, and then on a yearly basis onward. We use the appointments that we have to discuss the opioid maintenance therapy, to always also touch upon their Hep C infection, because it takes a couple of appointments to really get the patients ready for treatment. We treat psychiatric illness, which is very important to really have them ready for treatment. We have a social worker that takes care of their financial and social problems, which are very important to our patients. And we dispense our medications at the same time that we dispense the opiates, the methadone, which really helps to kick up adherence to treatment. We have very consumer-friendly opening hours. We dispense methadone from 6 o'clock in the morning to 9 o'clock in the evening. People can come in without appointment, and they get to see their psychiatrist or the internal medicine doctor, and we can discuss Hep C treatment just very quickly, even without appointments. And of course, you know, in Switzerland we have a very liberal opiate maintenance therapy, which also helps to keep our patients in care. And finally, we have also an infectious disease specialist in our centers on board, so we can really make referral very short. So this is our model of care. We have an integrated service. We offer opioid maintenance therapy, needle exchange. We test for blood-borne viruses. We dispense medicine. We vaccinate all of our patients. We have an ultrasound in our center, as well as elastography. And we have all the specialists that meet the needs of our special and vulnerable patients. It does come with a bit of a price tag. As you can see, we have altogether 30 physicians and psychologists work in our program. We have 4 social workers, we have nurses, we have a big staff of roughly 117 people, not all of them working full-time, of course. These services are split among 4 centers, and I want to just show you some of the results that we get from our work. This is a retrospective analysis of 66 patients that we treated. As you can see, these are not easy to treat patients with multiple substance abuse, with alcohol, regular alcohol intake. Many of them still inject drugs, psychiatric illness. And we treated them with PEG and RIBA, most of them genotype 3 infections. And as you can see, our treatment outcomes with an overall SVR rate of 64% is similar to other cohorts in non-IDU users. We've also looked at the factor of injection drug use, active injection drug use, influencing our SVR rates, and as in other works that have been published, we could show that active injection drug use does not really endanger our success rate when it comes to treating hepatitis C. So I would like to conclude that in Zurich we have an integrated low threshold service that is built around the needs of our clients. And we think that we can reach more patients with this integrated Hep C care than referring the patients to specialist services. And we would recommend other healthcare providers maybe to adapt one or few things that we do in Zurich. Thank you very much.
Thank you so much, Christian. Inspiring talks, all of them, I'm sure you'll agree. We are running up to time, so I'm going to leave the questions. I think if any of you have got specific questions for the speakers, then please do speak to them afterwards.